because of Jerome Gahan and Frank Page's work and the work of Wolf Friedman and colleagues, that we've learned a lot about the role of the immune system. And that's one of the most important things to take from here. There's a lot of data in animal models that suggest that tumors that are non-immunogenic, that don't have immune infiltrates, aren't going to respond to checkpoint blockade, are not going to respond to co-stimulatory molecules. And what this points to is the fact that we need to have things that are going to prime immunity. I think the colon cancer data suggests to me, although it's not been proven, that patients that don't have a positive Immunoscore, that have got that really low level, they're not really influenced, or they don't get better with chemotherapy or radiation or things. So that suggests to me that those two strategies aren't really effective at priming anti-cancer immunity. And what we really need strategies that will do that. And I think that's where cancer vaccines are fitting into this spot. I think there have been 4 failures of major vaccine studies so far this year. And I think that points to the naivete of the field, and really the stepwise progression we have to go through, where you have to do one agent first, get it approved, and then get a second agent. But it's really sort of silly. I said the people that have been working in preclinical models like myself for more than 30 years, right? We know that established cancer in animals you can't treat with vaccines alone, or if they're poorly immunogenic, with any checkpoint inhibitor or co-stimulatory molecule. But you can get amazing results when you combine those two. And so I think we're just at the point of starting to see those sorts of combination therapies. And I think that those failures, and in fact the one study which suggested that maybe the patients did worse, that's not something new. We've seen that before with vaccines, where it looks like they may have done worse with vaccine by themselves. And I'm not saying that they are, but the point is that if you turn on immunity and the T cells go to the cancer and they're making interferon gamma, they're going to upregulate PD-L1, and that's going to shut off those immune cells that are coming in. But if there's also an innate or an adaptive immune response going on at the site, it's likely going to also get shut down as well. So if somebody's battling their cancer and their immune system is fighting it a little bit but losing, I think you give a vaccine without checkpoint inhibition, you may be making it worse. So that's a possibility. So I think that's why we've got to be looking at combination immunotherapy. So that's part of what comes out of all this.